Hi, my name is Kathleen Morgan. I'm a primary therapist intern here at New Directions for Women. I started in the field of psychology 5 years ago when I initially started my studies at Pepperdine University. I have been working in the field consistently for the past 5 years. The past treatment center I was at was Hope House, and I started with New Directions for Women here about 6 months ago. My first master's degree is in holistic wellness with an emphasis in treating addiction with a holistic approach, mainly nutritional therapies and bodywork techniques. So when I got this job here at New Directions for Women, I was really excited because it kind of blends everything that I do, and they allow me to really work with the patients holistically, mind, body, and spirit. I like to specialize. I am specializing in trauma, and one of the groups that I do run here at New Directions for Women is called Seeking Safety. Seeking Safety is the most researched evidence-based practice out there for co-occurring disorders, co-occurring substance abuse with trauma. And what we find when we treat both those disorders together is that we have a less recidivism rate. If we don't treat those two together, we have a very high relapse rate. So one of the things that the women really like about the Seeking Safety group is it's consistent. They know what they're going to get when they get there. Each week they come in, they check in, how am I feeling? What have I been working on? Have I been doing any self-destructive behaviors? And then we go through the material for the week. And I go through it really slowly. There is really a lot of material there. Sometimes we'll only get through maybe 1 page of a module each week. And that's okay, because it's a lot of information. And the women really like it because they get to see that, wow, other people think this way. This is really because I've had trauma in my life. And I'll tell you what, in the female population, when I ask how many of you have suffered trauma, almost 100% of the hands go up. And it's either trauma that they experienced in childhood that may or may not have led to their drug addiction, but then once they've gotten into their addiction, alcohol or drug addiction, the things they have to do to sustain that addiction is often traumatizing. So what we found is that if you only treat the trauma, there's going to be a high chance that they'll relapse back to substance abuse. And if we only treat the substance abuse, the trauma that they continue to relive will lead them back to relapse too. So it's very important that we're treating these simultaneously, or else we're going to have a really high recidivism rate. And so we're trying to keep that down. This is one of the ways, as well as psychodrama, that we do treat trauma here at New Directions for Women. Thank you.